Padma Shri, Dr. Anil Arora is also joining us now live. He's at AIIMS Hospital. He's also, of course, a senior doctor joining us from London. Dr. Arora, as far as you're concerned, prima facie, what do you make of the injuries Saif Ali Khan has sustained? Can you tell us a bit more about the procedure that must have been conducted on him this morning? Reportedly, it was a neuro surgery. After that, there was a minor cosmetic surgery also performed. Just give us a bit more details about the procedure, and also now what the recovery period is like. How soon could we expect his discharge? Also, I'm sure his fans would be, wondering how soon could perhaps he be back to work, considering that now the good news is that he is out of danger. That is some reassuring news that we've got from the hospital.
Thank you, Uday, for having me on your show. First of all, let me correct my own introduction. I am not from London, I am from Delhi. I am working at Sir Gangaram Hospital. Regarding the injuries to Mr. Saif Ali Khan, as Dr. Sanjeev very rightly said, there are two components to patient attendance. One is how quickly can you get the patient into the hospital, and secondly, how quickly and how well do you manage it in the hospital. Fortunately, in our setup, at least in the private sector, most of the hospitals in the metropolitan cities they are pretty well equipped, both in terms of efficiency and urgency, for handling any type of emergency. So the moment they spot the problem, they immediately get into the investigative mode, and they hardly waste any time in trying to get on to the basics, like what had happened in Saif Ali Khan's problem. But problem is, how do you get onto the hospital? Now, here is a celebrity. He's one of the most celebrated actors in India, and his son had to come from another place to fetch him to the hospital. And in spite of the fact that you have a big celebrity, there was no vehicle to transport the guy from his home to the hospital. That is a crucial time which needs to be bridged and plugged. Now, this poor chap, Ibrahim Ali Khan, had to hire an auto rickshaw to wheel him into the hospital. Now, luckily, his spinal injury or back injury did not result in injury to the spine in the sense that would have resulted in compression of the surrounding nerves which would have been traveling through the spinal cord. But the fact that he had to be taken to the hospital through an auto rickshaw, that gives a very poor picture of our infrastructure in terms of availability of ambulance and the emergency services, which are so crucial in not only preventing the injury, but also getting to the place where the injuries can be handled swiftly. Full marks to the Lilavati team. Not only did they diagnose the injury very well, as Dr. Sanjeev said, he had an injury in the back of the spine, which was seen by radiologists, diagnosed correctly. There was a metallic object in the vicinity of the spine, and that the same thing had already penetrated into the covering of the spine, leading to the spinal fluid leak. So they repaired the leak properly, took out the metallic object, and they repaired the wound there and then with the help of a plastic surgeon.
Yes.
I think kudos to the Lilavati team for having done a fantastic job, and I think he should be back on his feet soon.
For more such videos, subscribe to the Newsx YouTube channel, hit the bell icon.